Well, Fred, thanks for taking the time. You seem to get accosted every step at a show like SRS, wherever you're walking.
It's been a busy show, that's for sure.
Yeah. I got to imagine you must look at this in a fond way that, you were one of the creators of this entire category of medtech.
Well, it's very rewarding to see the proliferation of robots, sort of broadly defined as effective new tools in the treatment of human disease. So I do feel very excited not only for how far we've gotten, but where this sort of general swell of innovation can go in the future.
And we're sitting here in Moon Surgical with the Maestro, and when we think about these new categories, right? Historically, if you opened up the dictionary and you put surgical robot, highly likely a Da Vinci would be sitting there.
Yeah.
But the fringe technologies are starting to move towards the middleman now.
Yes.
Right? And so where do you see the sort of ongoing next few years if we imagine what those digital solutions look like?
Well, I think it's going to be a very fascinating transition there's been certain, a number of phases. And this, when I talk about the transition to where we are today, I really don't start with the first robot. I start with the whole concept and focus of minimally invasive technique. That's what we're all trying to accomplish, do less harm and the most good to patients. And so it's been a transition, that started with how can we make a smaller incision to how can we make a smaller incision and do a safe procedure. And I think if you look at, the transition from conventional laparoscopy to robotics, surgery is a broad field, and some things fit very nicely in sort of the first phase of how do we do safe, minimally invasive surgery manually. And it was very clear that in that progression of technique, some of the things that you do manually or manually laparoscopically worked extraordinarily well, and some needed more technology. And so from there, I think there's been extensions into applications in fields of surgery or just, interventional therapy that, certainly I hadn't contemplated. And I think it's quite exciting. It not only has it gone deep in minimally invasive surgery strictly defined, but it's also gone very broad.
And most of the time, the best problem solvers oftentimes get to the critical questions to ask before providing a solution. And you said the first question you asked way back when was, how do I make smaller incisions?
Yeah.
But we're sitting here at a Society of Robotic Surgery show, and at least there's two big players on the floor here that do not make an incision, right? An Insight Tech and a Histosonics. So now we're not even asking the question about making an incision.
Yeah. Well, you're absolutely right. And what those represent is, at the base of it, a different way to treat tissue. And, surgery is partly about resection and removal of tissue, and partly about sort of reconstruction of tissue. And the removal section, if one can do that with no incision at all, it has obvious benefits. And I think those new companies that are able to do no-touch procedures that remove tissue, in other words, do surgery without touching the patient, are both extraordinary and a logical progression to and sort of an endpoint to some degree to this transition to less invasive technique.
And the final question, Fred. We see the use of AI, we see the use of machine learning, we see the use of advisement of the clinician while he or she's in the middle of surgery. One of the platform specialties of Moon is making the surgeon and the platform the center of decision making while they're in it.
Yeah.
How important, or where do you see that going down range in regards to this assisted surgery?
Well, what's so interesting about Moon is it is right smack dab in the center of, the use of minimally invasive technique as defined earlier and the use of robotic technique as defined later, with the overlay of we're living in an age where, a lot of decisions may be better made by AI and, machine learning and technology that has more to do with software than the hardware of either a surgical tool or a robotic tool. Yeah.
Well, Fred, thank you for your time as always.
Thank you. That wasn't too painful.
It wasn't bad, right? And I think I got you out in under 8.
Yeah, no, that's good. Wow.